All right, well, I'm going to share my screen and we're going to go ahead and get started. This is being recorded, so if you have folks who aren't on yet, you can always share that recording back if they've missed something. So let me go ahead and get that going. All right, and let me see if I can do this. Okay. All right, so welcome everyone to today's webinar. So excited to be here with you on this chilly, as I was mentioning, in Denver, Colorado morning. So I am Morgan Seiler. I am a regional behavioral health advisor in SAMHSA's Region 8 office. So if you didn't know, the Department of Health and Human Services has 10 regional offices across the country. I'll cover this a little bit more later, so I won't go into it too much, but today's session is called Mind Your Way. Train the Trainer for Behavioral Health Career Pathways. And so as a former educator myself, I thought that it would be really great to give you all a toolkit. So that's going to be coming in the next couple weeks. Bobby agreed he'd send it out to the whole listserv to make sure everyone gets it. It'll have a script. It'll have some activities that you can do in your classes to really help young people get a sense of what the career pathways look like for behavioral health. And we'll get a little bit more into the content of what that means in a little bit. We know that your students are energized about mental health. And so this presentation will provide you with the tools and knowledge that you can share with your students to explore these pathways and ensuring that they really get the many ways that they can show up in this space. And you'll see there are lots of ways that you can be involved in mental health and substance use in our country and our infrastructure and our system. So as a federal government agency, it's important to say that we aren't funded by anyone to do this presentation and that the content of this slide deck is not the official position of the Department of Health and Human Services. Just wanted to get that in there. And during our time together, you'll sense a theme here with the map, mind your way. So trying to find your way. So we'll discover SAMHSA. We'll explore behavioral health and traverse the continuum of care. We'll scout out behavioral health career pathways. And then finally, we'll wrap up with wandering through some resources for continued learning. So I'm excited, again, to be with you all today. This is a passion area of mine. When I was trying to figure out what I wanted to be when I grew up, it was really hard to know what those possibilities were. I knew I wanted to be involved in mental health and well-being and belonging, but I didn't really know how to get there. And I think if you don't know, you can't know. And so I'm hopeful that this will give you the tools to be able to know what those are. So let's start by laying a bit of a foundation for who SAMHSA is and what we actually do as a federal agency. So the Substance Abuse Mental Health Services Administration, or SAMHSA, is the agency within the Department of Health and Human Services. So under this kind of large umbrella, this huge department. And so we lead public health efforts to advance the behavioral health of the nation. So mental health and substance use is our jam. It sits, again, under this umbrella with many other operating divisions, some of which you actually might have an awareness of or be familiar with the acronym for. In government, we really love our acronyms, so I will say some of these out loud for you. So the FDA is the Food and Drug Administration. CMS is the Center for Medicaid and Medicare. NIH is the National Institute of Health, which also includes the National Institute of Mental Health, but all the other National Institutes of Health as well. The CDC, or Center for Disease Control and Prevention. The IHS, which is the Indian Health Service, which oversees a lot of programming and service delivery for tribal nations and federally recognized tribes. We have the Administration for Children and Families, or ACF, and finally HRSA, or the Health Resources and Services Administration. This is not all of the operating divisions. There are 11 total, but these are some of the big heavy hitting players in the space of the Department of Health and Human Services. So just wanted you to have that lay of the land there. And what do we do? So as I mentioned, we're the lead public health agency for mental health and substance use. So here are our strategic priority areas. We enhance access to suicide prevention and mental health services. So you'll find out kind of how we do that on the next slide. We promote resilience and emotional health for children, youth, and families, and HOSA is just one of the many ways we're involved with this strategic priority area. So we actually attend the International Leadership Conference every year and help sponsor some folks at the state level to be able to get to that conference for winning the behavioral health challenge that we put forward as an agency. We integrate behavioral health and physical health care. So we provide lots of guidance and best practices for how to do that to states and local governments. We strengthen the behavioral health workforce. So in addition to our partnership with HOSA, we also provide a lot of training and technical assistance to people who are working in the field of mental health and substance use. And then we work really, really hard to prevent substance use and overdose. So we have many centers and offices dedicated toward building out mental health and substance use supports for the American people. How do we do it? So we, as I mentioned, play a vital role in mental health and substance use, and we do this 3 ways. So on our little fidget spinner here, at the very top, we have grants. So we provide a lot of money. A lot of money gets appropriated through Congress to go through our agency and go to states and go to local governments and go to nonprofit agencies and universities, educational institutions to be able to provide services and to do training for folks in communities and the American public at large. Which brings us to the next arm of our little fidget spinner here, training. So in addition to the training that we have for our grantees or people who receive the money, we also have training that's open to anyone. And I will share how to access all of the training resources that we have available. And again, as a public health agency, the idea is to make it free and publicly available to everyone. And then finally, we produce a lot of resources. So we have something called the SAMHSA store, which I'll share a little bit more about at the end when we're wandering through our resources. But this store is terribly named because everything on it is free. There's lots of toolkits, lots of things that you can use in your classroom to be able to explain, different aspects of mental health and substance use. And yeah, we're hopeful that by learning a little bit more about us today, you'll check out our website and download some of those things and use them in your work. So let's start exploring behavioral health and traversing the continuum of care. And I will explain what that is in a second. So behavioral health, and I'm going to use that term throughout the remainder of the presentation, refers to the connection between, and really these are inextricably linked, right? Between behavior and well-being, which encompasses both mental health and substance use. And this includes mental health promotion, substance use prevention, substance use treatment, recovery, so recovery from a substance use disorder, recovery for a mental health condition or a mental health challenge, living with anxiety, living with depression. So really encompasses all of those things. And it's why we have that larger umbrella term, because just to say mental health or just to say substance use is too specific. We need something that really gets all of it into one big bucket. So that's behavioral health. So when you hear me say that, just know that it includes both mental health and substance use. Behavioral health spans the continuum of care, and most continuums, right, are a line. Our continuum of care is really a circle because at any point in your or your family's life, you might need services in different capacities, right, and kind of waffle between these different elements of care or levels of care. So we have at the very top, we have mental health promotion, substance use and mental health prevention, and we have early intervention. So these are things that happen maybe in your school, especially with campaigns around not vaping or engaging in risk-taking behaviors, might be coping skills or social emotional learning programs. So these are things that really help you build up your tool belt for when you have a mental health challenge, because mental health challenges are inevitable. They're inevitable for everyone. People have hard days and can fall into hard times. And so really building up that skill set is really, really important. And then if you move kind of along the circle in a clockwise fashion, we have primary care. So this might be where you go when you're not feeling well, maybe you have a flu or you have a stomach bug. These practitioners or these people that see you, these doctors, can know the signs and symptoms of a mental health challenge or a mental health concern and can help refer you to the right place should you need additional layers of support. Then we have crisis care. So I'm going to talk a lot about 988 later, but that is the suicide and crisis lifeline that's available nationwide. Anyone can call 988, but there are crisis care professionals that can help really de-escalate a situation. So if you're in crisis, if you're experiencing suicidal ideation, or really not having a great day and need that additional layer of support, crisis care is there for you. And a lot of schools actually have crisis teams that will provide that care in the building, in the school building. Then we have specialty care outpatient and specialty care inpatient. So again, these are just different layers and levels of support. So you might go to a therapist after school. You might actually be checked in to an inpatient psychiatric or psychological facility where you're receiving more intensive supports. And so again, these things can happen at the same time too, right? You might be seeing an outpatient, someone for outpatient for one issue, and then really need that inpatient care for something else that you might be experiencing. And then as we're kind of closing the loop here, we have recovery support. So this is the idea that your condition, your substance use disorder, or your mental health condition is really well managed, and you need those community supports or people who have lived or living experience with these conditions to wrap around you and to help you to stay well and to achieve wellness and well-being. So that is our continuum of care. And there are lots of roles all along this continuum of care and many entry points into behavioral health careers. So let's get into those. Let's get into some of those behavioral health career pathways. As we explore the diverse opportunities within behavioral health, it's really helpful to organize those careers into three main pathways. So each pathway represents a unique approach to supporting mental health, and again, all along that care continuum. And this really offers you as students a variety of roles to consider based on your interests and based on your strengths. And so we try to frame these slides in that way that, like, if you're thinking about this, you might want to consider this career pathway or this role. So the first one is in our green here, off to the immediate left, and that's public health, promotion, and prevention. So this first pathway emphasizes proactive strategies to prevent mental health and substance use challenges before they arise. So professionals in this pathway work to educate communities, implement evidence-based programs, and advocate for policies that promote health equity. And actually, careers in the federal government, in federal service, are in this bucket as well, which is pretty cool. So at different systemic levels, you could be working to promote and prevent mental health challenges. So very, very cool. Careers here include public health specialists, prevention coordinators, and community health workers. I will go into each of those. And it's really ideal for students who want to make a broad impact at a population level. The next pathway, or here in this HOSA maroon color, is the recovery and lived experience. So this second pathway really builds on the power of personal stories and peer support. So as I mentioned before, it's like the lived and living experience with mental health or a substance use challenge or disorder. So roles like peer recovery specialists and recovery coaches really allow individuals who have that lived experience to guide and mentor others in a strengths-based way. So these professionals offer emotional support, share coping strategies, and help individuals build meaningful lives in their recovery journey. It's a really deeply personal and rewarding career path for those who want to inspire hope and resilience if after you've been through something yourself. And then pathway number 3, which is that other one on the left in the teal kind of blue color, is primary care, crisis care, and treatment. So this might be what you immediately think of for the way that you can show up with regard to mental health and substance use, because it includes, where you work directly with individuals addressing immediate mental health and substance use challenges. So careers in this pathway include crisis intervention specialists, counselors, therapists, psychiatrists, and really these professionals provide not only assessment and therapy, but can also help folks manage medication and critical support during times of crises. It's really an excellent option for students who want to work hands-on with individuals and families to make that direct service impact on people's well-being. So these are our kind of three buckets, and this is how we've organized the different roles in behavioral health as we move forward. Before we get into the specifics of those roles, one of the most critical aspects of behavioral health care in this country is the collaboration among multidisciplinary teams. So these teams bring together professionals from various disciplines. So again, across those three kind of buckets or ways of showing up with regard to behavioral health care. And they each play a unique role to ensure comprehensive whole human care for a person or for a family or for a couple who's seeking that care. So we begin, and I have those, three types of professions down here below, and they're all kind of funneling up into that person, their family, their immediate circle, their chosen family, and really helping to wrap around them. So within our green bucket, public health campaigns, which again play that foundational role in reducing stigma and improving mental health literacy, the campaigns create an environment where individuals feel empowered to seek help, right, in the first place, without fear or shame. Mental health promotion and psychoeducation focus on building coping skills and resilience. Anyone can always benefit from additional coping skills and ways to get through, challenging times. This work is actually often done in schools, workplaces, and community settings to ensure that people have the tools they need to manage the stress and thrive in their environments. Again, stress is a very natural and normal part of life and normal part of development and growth. And so it's really important to make sure that you have some tools and some skills to be able to cope with that stress. Prevention professionals really raise the awareness of risk and protective factors. So they help communities understand how to reduce the likelihood of mental health or substance use challenges while promoting protective factors that protect against them, like strong social connection and access to support services. So again, those prevention professionals are really good at knowing what the needs are of a community and helping to connect folks to the supports that they need at any given moment. In primary care settings, healthcare providers screen for early signs and symptoms of mental health or substance use concerns, and that early detection is really the key to connecting individuals to the right level of support before the issue escalates beyond, the scope of what that provider can provide. When someone is in immediate crisis, crisis care steps in and provides that urgent support, whether it's our hotline like 988, a mobile crisis unit, which again, a lot of schools have access to, or an emergency room. This care is there when you need it and will help stabilize a person in this situation and connect the person to longer term resources, which is really vital and really needed. Therapeutic services, whether outpatient or inpatient, provide that appropriate level of care. And outpatient therapy often offers ongoing support while individuals live in their communities. And then the inpatient provides the intensive care for those who need a more structured environment or more intensive support. Medication management is available when clinically necessary. So psychiatrists, primary care providers, and other trained professionals help individuals find the right medication to support their mental health or substance use recovery and as part of a broader treatment plan. So oftentimes if medication is being prescribed, therapy will also be recommended so that you can get those behavioral strategies while you're also working to figure out the medication aspect of your treatment. Community supports, as I mentioned on the prior slide, wrap around individuals to improve their outcomes with overcoming a mental health challenge or mental health diagnosis. So this could include housing assistance, vocational training, support groups, and these services really address something called the social determinants of health. And so if you haven't already explored what that means, I encourage you to Google it and take a look. When I provide the toolkit for HOSA advisors to be able to do this lesson in their classroom, plan to include a lot of information on how to explain what the social determinants of health are and how you can really bring that to life in your classroom. So these social determinants can provide those protective layers of support and really, addressing those will help increase the likelihood of long-term well-being and belonging and connectedness. So by combining their expertise, again, it's kind of like the Avengers of behavioral health, these multidisciplinary teams ensure that people receive the right care at the right time and in the right setting. So this collaborative approach is really essential, as I mentioned before, for improving mental health and substance use outcomes, both supporting individuals, families, and the broader community. So without further ado, let's jump into the roles of our first pathway. So our first pathway is public health, mental health promotion, and prevention. So community health workers, or CHWs, are trusted community members who bridge gaps in healthcare systems. So they really provide that health education, connect folks to resources, and address those social determinants of health like housing and nutrition. This career path is accessible with a high school diploma or a certification. So that varies by state, making it a great starting point in behavioral health. So again, graduate from high school, looking for something, a way to get started in behavioral health, this could be it for you. And I just want to kind of orient you to the way that these career pathway slides are organized. So they're all organized in the same exact way. There's a little schema to it. So on the left-hand side, we have the title of what the role is. Underneath that, we have a brief description of who that person is. And then you'll find what they do, how they do it, and then how you can get there, including educational and training or licensure information. And then we wrap up every slide at the bottom with specific resources to learn more about the role or field of practice for that particular career path. Our next role in public health, mental health promotion and prevention is prevention specialists. So they really focus on reducing risks related to mental health and substance use. They implement evidence-based strategies, conduct community education, and build resilience through targeted programs. So these are program implementers. They're out there, they're doing the work, they're doing education, they're teaching people about what these signs and symptoms are. A bachelor's degree in fields like public health or psychology is typically required or seen in this role, along with certification like certified prevention specialists. So really you can inspire students to explore the role of a prevention specialist if they want to proactively build healthier communities by addressing those risks and promoting resilience. So that is prevention specialists. The final role in this pathway we want to highlight is public health professionals. So public health professionals work to improve population health. So again, a little less targeted, a little more, 30,000 foot view through education, policy, and prevention programs. So they really work to address challenges like mental health disparities. So the idea that one group might be over-identified as having a mental health challenge in a group. So really trying to create equity in access to care, in the way that we are showing up and supporting people, in the way that we're not criminalizing people unnecessarily for a mental health challenge or concern. And promoting that equity is a key part of being a public health professional. So these roles often require a bachelor's or a master's degree in public health and sometimes require certification. And there's a couple of acronyms there. You could take a little bit of a deeper dive outside the context of the webinar. But students interested in community-wide impact should consider this path. And as an FYI, roles in state and federal government, including my role, are often included in this pathway as well. So many ways to get there. Now we'll dive into what the recovery, lived experience, and well-being role is. So since this is an emerging pathway, we really only have one role to share at this time, but the field is growing and we're likely to see additional job titles and descriptions coming online in the next few years. So keep your eyes and ears peeled for that. But currently we have peer recovery support specialists. So these folks use their lived experience with mental health or substance use to mentor and support others. They provide emotional support, guide individuals in developing recovery plans, and connect them to resources, especially if they're in a situation where they've experienced a bout of recovery and well-being and resilience, and then they're finding a trying or struggling to really, feel well, then that person can really help get them connected back into more intensive support or treatment. Training and certification programs ensure peer support specialists are equipped to make a lasting impact. So, in this role, students can actually use their compassion and shared experiences to guide others toward recovery and wellness. And again, we have the what they do, how they do it, how you can get there, and then those resources that you can take the deeper dive into. Now we've come to our final pathway, which might be the way that immediately comes to mind when you think about working in mental health and substance use. But this is primary care, crisis care, and treatment. So we'll start with where you are at school. So, school counselors, school social workers, and school psychologists are essential in supporting student mental health. You actually might know some of those professionals in your school building. They provide counseling, implement mental health programs, and collaborate with educators, with teachers, and support staff to foster safe and supportive environments. So these roles typically require advanced degrees and licensure tailored to educational settings. So oftentimes these licenses are actually overseen by state departments of education rather than state departments of public health or state departments of human services. And so I'll highlight the differences between these three school roles as we move through the three slides about them. But for school counselors, they really focus on academic and career planning along with personal development. So they work with students directly on academic and personal growth. They also sometimes oversee social emotional learning curriculum or initiatives in a school. They might host a mental health awareness club. So lots of different ways that school counselors are showing up to support students, but a big focus on what you're going to do next and what that career and vocational pathway looks like as well. School social workers address social and family dynamics, connecting students to community resources. So again, you might have some resources in your community related to nutrition. A lot of schools have like backpack programs and different things that really support students who need meals over the weekend. They collaborate with families and external resources to really address barriers and help people be able to overcome some of those barriers so that they can show up in the learning environment and get what they need out of school and be able to experience well-being, belonging, and connectedness. You also need a master's in social work in order to be a school social worker. But again, this licensure is overseen by the departments of education in every state. School psychologists specialize in assessments and interventions for learning and psychological needs. So they do a lot of testing in schools. If you are on an individualized education plan or IEP, you might have interacted with a school psychologist. They really focus on those evaluations, behavior plans, mental health strategies, and you typically need a specialist or a doctoral degree in school psychology to be in this role. But again, that's it varies by state. And so it's important to look into those licensure requirements by state. And actually, SAMHSA just came out with a really cool tool for being able to look at licensure across states. So we'll get to that too. Community-based social workers, so we're moving away from the school and now moving into the community setting. So community-based social workers provide case management and connect clients to essential resources. So just like our school social worker connects students to housing, healthcare, and different community-based resources, community-based social workers connect people who are maybe not in a school, connect to those different social determinants of health that can really help reduce barriers to them um, you know, getting care or experiencing a mental health challenge. They also offer counseling and therapeutic interventions to address emotional and behavioral needs. So you can be a licensed clinical social worker and help individuals navigate personal challenges like mental health issues, family conflicts, or substance use disorders. Social work is an incredibly rewarding career path for those who are passionate about helping others and advocating for social justice. So there's a lot of advocacy in this role as well. And you can encourage students to consider this if they want to make a meaningful difference in both individual lives and really society as a whole. Very, very cool to have that sort of direct service, but then that broader sort of reach in the advocacy piece of this role. Substance use counselors assist individuals in overcoming addiction through therapy and treatment planning. So they work in clinics, hospitals, and community programs, and sometimes in the inpatient psychiatric settings that are specific to substance use, like detoxification facilities, different programs like that. Students can start this path with a bachelor's degree and pursue certifications like CAC or LADC. And again, those are kind of listed out here, and you can learn a little bit more about those if you want, using some of the resources to advance in a career for a substance use counselor. Marriage and family therapists focus on relationships and family dynamics, which can be a little tricky. I have some friends who are marriage and family therapists, and they have some interesting stories. Not violating any HIPAA there, but it can be very interesting to manage, the mental health challenge and experience of more than one person in a particular therapy session. So they address challenges like conflict, trauma, communication. They provide therapy to couples, families, and individuals too. But really that focus on family systems is their jam. They require a master's degree and licensure. So there is a clinical component here where you have some supervision. And in order to get licensed, you have to have so many clinical hours. So this career is ideal for those passionate about helping people strengthen their relationships. So if you're a relationship-driven person, this might be something you'd be interested in. Mental health counselors work directly with individuals, families, and groups to address things like anxiety, depression, and trauma. Again, this career requires a master's degree and licensure, making them pivotal in outpatient settings. Sometimes mental health counselors are also coming into your school. They might be a contracted provider or be someone employed by the school district, but happens to have a license in mental health counseling or be a licensed professional counselor. This career offers opportunities to specialize and make a profound impact in people's lives. So if you have a certain specialty that you're really energized by or think you might want to get into, mental health counselor is a cool career pathway to consider because there's lots of different directions you can take it once you have that educational and licensure credential. Psychologists specialize in understanding human behavior and mental health. So again, just a little more schooling here. Does require a doctoral degree, so a PhD or a PsyD, which is a doctor of psychology. They assess, diagnose, and treat psychological disorders, often conducting research too in university settings to improve interventions. So this role, as I mentioned, requires that doctoral degree and a licensure, again, similar to the mental health counseling and the marriage and family, where you have to do some direct service clinical hours and then sit for a licensure exam. But there are opportunities to specialize in areas that are a little bit different than mental health counseling, like clinical or forensic psychology. So if this feels like something that energizes you, this could be something that you want to look into a little bit more with those resources down there at the bottom. We have the American Psychological Association noted there. And on all of these slides, if there is a national association for the career path, we've included that as a resource. Psychiatrists are medical doctors who diagnose and treat mental health disorders, often through medication management. So that might be the primary reason you're going to a psychiatrist. However, they do psychoeducation and therapeutic counseling. So after completing medical school and psychiatric residency, they may choose to specialize further, such as in child psychiatry or addiction psychiatry. So this career offers both medical and therapeutic approaches to behavioral health. So if you're interested in being a doctor, but really want to be more on the mental health and substance use side of things, this might be the career pathway that you might be most interested in. And finally, in our treatment portfolio here, we have non-psychiatrist physicians. So this might be your primary care doctor, your pediatrician, if you are still seeing a pediatrician, if you're under 18. And these folks also play a role in behavioral health by managing medications for conditions like depression or anxiety that don't require that really high level of care of a psychiatrist, but really can be managed more in the primary care setting. These professionals integrate behavioral health into general practice, so lots of screening. Maybe you've actually completed a depression screener or anxiety screener at a primary care visit. That is integrated care at work. Be kind of cool to be able to say that the next time you go to the doctor's office, and really improves accessibility for patients, right? Not everyone can make time out of their schedule to see multiple providers. So this is a really great gateway and pathway into getting a higher level of care if you need it. Additional training in mental health integration is really valuable in this role. So we've again linked the American Academy of Family Physicians, some behavioral health specific resources here, and encourage you to check it out. So if you do want to go to medical school and you do want to be a doctor, just know that mental health will come across your desk at some point. And so just knowing that that can be part of your portfolio might be helpful as you consider what you want to do next. So we're going to wrap up our time together, and then we'll have a little bit of time at the end for some questions. If folks have any, you can put them in the chat. Wandering through some resources for continued learning. And when we turn this into the script and slide deck and activities, we're going to do a little scope and sequence for you, connect it to some national standards for health education. And when we do that, there will be some resources we have in here that we're not going to cover today because they're currently going through the clearance process. I actually got wind this morning that we're going to have a youth-facing career one pager that I think is going to be really helpful when talking through these things within your classroom. But the resources I share today will also be included. So we have a new behavioral health career navigator. This is so exciting. It literally came out on a month ago, November 13th, it came out and went live on our SAMHSA website. So it's really an invaluable tool for students who are interested in exploring careers in mental health and substance use. And it's designed with aspiring professionals in mind. So what do I need, given the state that I live in or want to live in the future, to be able to do what I want to do? And so this interactive resource provides that comprehensive information about the wide variety of career pathways in behavioral health. So here are some key features. This tool can really help students discover roles that align with their interests and skills. So there are, and a lot of the content I pulled for today's webinar comes from the detailed descriptions of those career options. Educational requirements and training pathways for each career are also delved into at the state level, which can be really helpful because, as I mentioned on all of the career pathway slides, this varies state by state. And it's a little bit annoying, but that's just kind of the way that the structure works. So I was licensed in Florida. I'm not licensed in Colorado. So there are differences in the educational requirements and clinical hours required and different training that you would have to do in order to be licensed across state lines. So how it can benefit your students, the Career Navigator can really empower your students to make those informed decisions about your future by providing the clarity and actionable guidance about what it's going to take to get me there in terms of what I'm inspired by and what I want to be later in life. And so we have the QR code here, also included the hyperlink. And again, we're going to share this slide deck so you'll have access to all of the links that are embedded on the next few slides as well. And again, this is going to be iterated. So it doesn't currently have the school-based roles on it. It is something that we've provided feedback about and we hope to include in the future. And I imagine there will be even more roles added to this as this tool iterates over time. There are also some federal supports for your career journey, which is pretty exciting. So there are federally funded programs available to you as students, as undergraduate students, as students who are graduating from high school, and as graduate students if you decide to pursue continued education after an undergraduate degree, like a bachelor's degree. So we have SAMHSA's Minority Fellowship. So it's awarded to around 400 students every year and is designed for people who are pursuing graduate degrees in behavioral health. So it could be something that you're interested in applying for. There's also the National Health Service Corps. And so this is kind of a wild number. It's very big. Supports more than 17,000 primary care, medical, dental, and behavioral health providers through scholarships and loan repayment programs. So if you're interested in going into one of those roles and are looking for a way to have your loans forgiven or repaid, that could be a really great thing to explore. The CDC has a public health associates program for recent graduates. And actually, I worked with someone who went through that and just speaks high praise of it. And it's been around for a really long time. So this could be something that you're considering if you're thinking about the public health or preventionist side of the behavioral health continuum. And then there's the Commission Corps of the U.S. Public Health Service. So similar to the way that the National Guard shows up when there's an emergency, the Public Health Service Corps are public health professionals, so including mental health clinicians who show up when different things are going on that require additional levels of support. And the public health service officers really have graduate and undergraduate students on America's front line. So if this inspires you and feels like something you'd like to do, there's also really meaningful work done within the U.S. Public Health Service, and lots of opportunities for loan repayment and tuition assistance and different aspects of educational, continued learning as you go through. And I would be remiss if I didn't mention some of the big three SAMHSA resources in terms of finding support, finding treatment, and then of course the crisis care that we help stand up as a federal agency. So Find Support is a really user-friendly resource for anyone seeking information about mental health and substance use. It offers guidance on identifying challenges, exploring treatment options, and learning how to support yourself or a loved one on the path to wellness. FindTreatment.gov is actually the larger umbrella. The Department of Health and Human Services stands up this resource. SAMHSA feeds information into it, as do other agencies under the umbrella. But FindTreatment.gov is a comprehensive directory of treatment facilities for mental health and substance use across the US. It allows users to search for providers by location, type of care, accepted payment options. So really trying to make it easier than ever to find accessible quality care. That is findtreatment.gov. And then the 988 Suicide and Crisis Lifeline, I'm hopeful everyone on the call today has heard of, but it is a 24/7 free confidential service that connects individuals in crisis with trained counselors. So whether it's a mental health emergency, a substance use challenge, or a need for emotional support, 988 ensures that help is just a phone call, text, or chat away. So please share this. We have the partner toolkit linked here as a QR code. There's lots of free materials that you can actually order. We encourage HOSA advisors, place an order. It might take a minute to come to you, but the posters and materials are really beautiful and can make a really lasting impact if you hang them up in your school or around the community. Oh no, just skipped another slide. All right, and then as I mentioned in the very beginning, SAMHSA supports nearly 50 technical assistance and training resource centers, which is so many, and coming soon online. I think the beta might already be on the site if you go to this QR code, but there's a search engine, finally. We're so excited to have a search engine for all these resources and training that we offer for free for everyone to access. So there are topics like suicide prevention, social media, mental health literacy. I've included some of the ones that I think would be most helpful for HOSA advisors and in school-based settings. But again, there's nearly 50. And there are some that are topical focused like suicide prevention, but then there are also some that are population focused. So there's a whole center dedicated to LGBTQ plus behavioral health. There's a whole center dedicated to Native American and Alaskan Native mental health and substance use. So lots of really great training and resource tools available to you. The Mental Health Technology Transfer Center is now sunsetted, but classroom-wise remains alive and well and is a really low barrier to entry training for HOSA advisors or for folks in your school to learn how to support mental health friendly school and work environment. And so there are some tailored resources on there that you can use in your school. And there's also an educator well-being module that's really, really great because we all need to take care of ourselves, and taking that time out to learn some of those ways that we can do that is really meaningful. So I just wanted to share those. And then, as I mentioned at the beginning, SAMHSA has 10 regional offices, as do many of the operating divisions of the Department of Health and Human Services, but these are your regional office contacts. And so we've included a QR code here so that you can go to the website and get their information. But we in regional offices show up for HOSA in a variety of ways. So we can actually serve as a judge for your state competitions. We would be happy to talk to you more about that offline if that's something that you haven't done before. Reaching out to your regional office, we're here to be that bridge and that connector to SAMHSA as a federal agency. So that is us. And I think she's on the call, but our current senior regional advisor, Tracy Pohl, my teammate and colleague, is on the line. And so we're very passionate about HOSA. We think it's really, really great, and love going to the conference every year too. We encourage everyone to please stay connected to us. So if you're interested in substance use and mental health updates, we have a SAMHSA email list. There is a youth button, hopefully now, that you can click. If not, it'll be there in a week or two. So we're going to have something called Youth Connected, and it's going to be a youth facing quarterly newsletter that's going out with opportunities for paid contribution to help inform some of the things happening at the federal level, different trainings or things that we think young people might be interested in, conferences that you might find interesting or want to attend. So please sign up for that. And then our HOSA advisors can actually opt into our regional newsletters. You can also opt in to learn more about specific topics, funding opportunities. We do have several grant funding opportunities that are available for schools and districts to apply for. So that might interest you. And then we definitely wanted to mention the HOSA career information page. Lots of really good information that Bobby and the team are always putting forward on that page. And so we're hopeful that this Train the Trainer will end up there or in the resource library that you have available to you as well. And as I mentioned, it's coming soon. I'd hope to have it ready by today, but I checked in with my contact this morning, and unfortunately, some of those youth-facing resources aren't yet available. So wanted to wait and roll that up all at once into a file share that will have a QR code and a URL for you to use in the classroom. And again, it'll have scripted notes. It'll have some of the health education standards that you can tie the lesson to, should you need to do that for an observation or whatever it is that you might need to do in your classroom. And we'll have some hands-on activities where we encourage young people to use their Chromebooks or laptops, whatever technology you have available to you, to explore some of the resources that are linked and tagged on the variety of educational and career pathways that are highlighted throughout the deck. And here you have our SAMHSA team at the HOSA International Leadership Conference this past year, and we look forward to seeing as many of you as possible in Nashville next year. So that is it for the presentation today. I'm going to stop sharing, and I'm happy to take any questions that might be in the chat. Oh, wow. There's a lot of information in the chat here. Okay. Will the slides be shared? Yes, the slides will be shared. Okay. I'm glad you're finding it helpful. Thank you so much for the feedback, Savannah. Okay, everyone's really energized by the slideshow. Me too. I'm excited to get it to you. Again, that will likely come out the first week in January. So again, we'll have the scripted notes with the timing and a way that you can deliver this in the classroom. Great. Glad you're going to share the recording. Awesome. Yes, HOSA does have the behavioral health competition. So the behavioral health challenge is actually sponsored and supported by SAMHSA. And so those guidelines, thank you for linking those. That's perfect. Great. All right. Will there be a code for this webinar for the LCP? I don't know what the LCP is. Christine, if you could share what the LCP is. And unfortunately, no one's able to come off mute by the way that this is set up. And I will say this was not an exhaustive list of all the roles that you could have with regard to behavioral health. These are just kind of the main ways that you can think about getting involved with it. And there are likely folks that we have left off. And we might think about adding those, like neuropsychologist, Tracy. So yeah, good note there, Evelyn, about careers that link to both fields, for sure. How will we be able to access the recording? So Bobby has told me that this is going to go on the HOSA YouTube channel. So that's how the recording will be able to be accessed. But again, we're going to provide a student-facing script for you to be able to deliver this to your classes so that it can be a bit more interactive than just tuning into a video. Great. The slideshow will be emailed to you. So we will send out the toolkit. Again, I will send that to Bobby the first week of January, and he will get that out to all of you right after I send it. And Bobby has linked HOSA's YouTube channel there. Grace, I'm not sure. That's a good question. Bobby, oh, we have your email. Perfect. Yep. He has all the advisors' emails. That's great. All right. The certifications are free, Crick. That is not always true. No, there are some certifications that are supported through different funding streams, and there are scholarships available for some certifications, but many of them require payment or require tuition. So yeah, important to dive into those resources to understand a little bit more about the financial impact that some of the career pathways could have, for sure. Bobby, maybe you can answer the recording being uploaded to YouTube question. I think you said early next week, but Monday, he says. Wow, he's on it. All right, well, thank you everyone for being here. I will remain on the line for another couple minutes, but just really appreciate your time today, and it's so wonderful to see so many of you in space today. Thank you. All right, Bobby, looks like the chat has slowed down. Thanks so much for having us. Really excited, so.
Thank you so much for a wonderful webinar with great information. We appreciate your continued support of HOSA. Have a wonderful weekend.
You too. Bye.